Some of you may have seen bits and pieces of this presentation. It's been very popular, so I thought I would do it again and add more components to it this time around. For those of you who don't know, I'm Stacy LeBaron. I'm the head cat at the Community Cats podcast, and I have over 30 years experience working in animal welfare with a specific focus with regards to cats and helping cats. I actually have started thinking of myself more as a feline entrepreneur. That's my new tagline for myself. I have been a head cat, now moving into feline entrepreneurship. But I am the host of the Community Cats podcast, and I have worked with many nonprofit organizations as well as an advocate. I'm on the board, I think, of 6 nonprofit organizations at this point in time. And many of you know that my goal is to help you turn your passion for cats into action with your own organizations. And so I have been board president, I've been vice president, I have been secretary, I have been treasurer, I have done the whole grand slam of positions within a nonprofit organization. I am president, that is with the Merrimack River Feline Rescue Society. I'm president of Positive Pantry, which is actually, it's an organization that provides pet food to families in Vermont, Massachusetts, to be able to help families be able to keep their pets. I'm with United Spay Alliance, their director of strategy and their treasurer. So as many of you know, spay neuter is very close to my heart. I'm also treasurer for the Vermont Humane Federation and advisor with the Massachusetts Animal Coalition. I have a partnership with the Community Cat Clinic, which is in Woodstock, Georgia. So if you Google Community Cat Clinic in Woodstock, Georgia, you'll see what I hope to be as a new model for how we're treating cats in our communities. And I am also a consultant to a lot of animal welfare foundations that are looking for guidance on how to direct their funds. And we also am the founder of the Community Cats Grants Program, which has lived here at the Community Cats podcast for quite a few years and is now over at the United Spay Alliance. Feel free, there's a QR code there. Feel free to go on that QR code to be able to subscribe to our podcast if you haven't. It would be great for you to be able to support the show. All right, next slide. So when I started working with the Merrimack River Feline Rescue Society back in 1994, there were over 300 cats on the Newburyport waterfront. There was a gentleman who had, a lot of the cats were living in boats that had been wrapped up for the winter. Gentleman had used a baseball bat to get rid of one litter of kittens that were living in the boat. Another litter of kittens had tested positive for rabies. There was a lot of disease, a lot of suffering going on down there on the waterfront. And so, many of us, when we saw that their trap, neuter, return program did start in 1992, from my perspective, I did not want what we were seeing in Newburyport at that time to happen in any other part of the country. I mean, what I'm seeing, I was sure someone else was seeing someplace else. And so that's where my theme for 2024 and here at the Community Cats podcast has really been pulled forward, which is see it, solve it. We've had a lot of challenges over the last 4 years with regards to access to spay neuter for our TNR organizations. We were very spoiled early on with a lot of capacity and access to spay neuter services with the growth of the Humane Alliance clinics. And we are now at a juncture. We are at a point where trap, neuter, return organizations, shelters, adoption centers, we have to create our own capacity, either by working in private practice and trying to negotiate a way to work with them for access to spay neuter, either by sharing high quality, high volume spay neuter techniques with them, having them do neuter only events, or thinking outside of the box, creating our own MASH style clinics that are done on 1 day a week when the clinic is closed. It's really trying to take a deep dive in your own community and understanding what those capacity needs are and being able to grow your spay neuter capacity significantly. I think that is one of our tragic losses that we've had over the last 5 years. So as an organization or as a collaborative group, so as a coalition, the goal should be to reduce the number of free roaming cats and kittens in a community. And I don't see any way around this other than by creating a defined strategic target area in order to be able to be impactful. I'm going to mention some resources, and it may take us a little bit of time. We'll make sure we get them in the chat. We just released a blog out on the United Spay Alliance's website, which is a case study of a pilot project that we did in Lowell, Massachusetts, showing how drastically the numbers can reduce when you have a high volume, high quality spay neuter initiative for trap, neuter, return cats, as well as for owned cats. And I'll get into that in a little bit more. But my definition of a community cat is 4 paws on the ground. And it's, you know, if they're outside, not spayed or neutered, 4 paws on the ground, that is a community cat. And that's a cat that we can play a role in helping assist them. So yes, everybody, it is see it, solve it. We are going to be the ones that are helping to solve the situation going on in our communities. That is what we're doing here in 2024. Next slide. So I've touched upon a few of the case studies. I'm just so excited that this case study in Lowell is finally released. I can't even tell you how excited I am about it, because I really think it is a great model for success. But first, I'll talk about Newburyport. Peter Wolf and Dan Spay, one of our presenters this weekend, did a wonderful analysis of Newburyport. Brian Cordes from Neighborhood Cats even visited us. He came to look at the feeding stations and there were no cats. And he was like, where are all the cats? And he came later in the process with our trap, neuter, return program there. And by that point in time, we only had a handful of cats left at our feeding stations. But we started out in Newburyport with 300 cats. They ended up being served by 14 feeding stations. It was started in 1992. And then forward through, but to 2008, the last cat passed away and the feeding station was closed. So at this point in time in Newburyport, they do not have a free roaming cat situation. Yes, there are cats that do go outside. We have been the Merrimack River Feline Rescue Society, and I'd say pretty traditionally across Massachusetts, and there are several folks out there from Massachusetts can talk otherwise, but we have a pretty general consensus that microchipping of our adopted cats and neutering before adoption of our adopted cats is really the best practice. And so many of those outdoor cats will be brought into our adoption program at the Merrimack River Feline Rescue Society and scanned, and then they're returned back home. So everybody knows who everybody is at this point in time. The Newburyport situation too, in 1996, we adopted out feline leukemia positive cats. In 2003, we had moved into a cageless adoption facility. We integrated our FIV positive cats in with our negative cats at that point in time, which really helped getting those cats adopted out. So really tried to think about having an outside the box, thinking like cat, not thinking like dog shelter tweaked to facilitate cats. That's really the mindset of where we were at with the Merrimack River Feline Rescue Society in those days. What are the needs of the cats of the community? Not the shelter, not our capacity to care, it's the capacity to care for the community of cats that we have. So just trying to make sure that your mission-focused mindset is sort of oriented on the community as a whole and not just one part of it. If it is one part of it, your organization says we can only do this piece of it, that's okay, but then work to collaborate with others so that you do understand what's going on in the community as a whole. So you might partner with a spay neuter clinic, or you might partner with a neonatal kitten organization. You might partner with an adoption organization if you're doing strictly TNR and maybe advocating for some public spay neuter. So there is a link to the Newburyport story, I will say, in there. And I really recommend you take a look at it. I do believe that as you're first starting out, thinking geographically targeted is really the best start, because then you're going to be successful very early on, and then you'll be able to grow. So it'll be like spokes in a wheel, right? So you'll have your center of the wheel, and then you'll be able to grow out from there, and you'll have an anchoring point where if you're very diluted in your efforts, you'll be frustrated because you won't be able to see the impacts. So when I talk about Lowell, Massachusetts is a very diverse community in Massachusetts, economic challenges there. And the Merrimack River Feline Rescue Society partnered with the Lowell Humane Society. So there was like one humane society there. So it was very easy to capture statistics. And we would go there once a week with a mobile spay neuter clinic, our cat mobile. and we offered spay neuter services for owned cats as well as for unowned cats. We had been doing, the Merrimack River Feline Rescue Society had been offering free spay neuter services on every Sunday, one Sunday a month for MASH style spay neuter for trap, neuter, and return. I would say pre 2008, there was very little spay neuter going on for folks that couldn't afford the surgery for their own cats. And so in 2008 was the first time we embarked on this process, and other organizations like the MSPCA, Dakin Humane, Second Chance, Animal Society, they all embarked on a plan sort of across state where we were going to start offering services for owned cats. There was an organization, Second Chance Fund for Animal Welfare, which was doing what was called quick fix clinics. That was from about 2004 to 2007, and they were sort of on the front lines offering spay neuter services for folks that needed assistance. And then we had Alliance for Animals, which was also very early on in the Boston area, offering affordable spay neuter services. And there was another group down in Dartmouth, Massachusetts too. So there were these pockets, but I think around 2008 was when we were really trying to get sort of more statewide with that. So another thing to say too is that, no city is alike, right? So a Newburyport solution, the Lowell solution, were very different. Newburyport was more of a trap neuter return oriented and an adoption oriented situation, where Lowell, that community needed a lot more access to spay neuter care. Fitchburg reached out to us for another pilot project, and they do not have a centralized facility. So the data collection's been really challenging there, but we also started a program there. We were invited in by the Board of Health and the fire department. We actually just went back to the fire department again with our Catmobile, visiting Fitchburg on a regular basis. And that is a community that truly needs a lot of access to care for owned cats. They did do that pilot group, did a lot of trap neuter return, but now the trap neuter return needs are a little bit lower on the population scale, but they still need significant spay neuter support. And there's actually grant funding for that community that continues to this day to help support that community. But their complaint calls are way down. They've been able to really professionalize their animal care services, and they've really done a great job. But we were doing monthly meetings, both in Lowell and in Fitchburg. We were doing monthly meetings with the community members to have them get engaged, because they were the ones doing the work on the ground. So both Lowell and Fitchburg became their own nonprofit organizations and broke off from the Merrimack River Feline Rescue Society. So those are some of the synergies that can happen as a result of doing these pilot programs, and really successful situations in those communities. Okay, next slide. So another thing that I'm hoping for in the See It, Solve It campaign that we have going on in 2024 is what I call the normalization of trap neuter return. I get so excited when I have a love-hate relationship with Facebook, but when I do go on Facebook and somebody posts about a need for assistance for cats in their community, and everybody jumps right on board and says, oh, you've got to do trap neuter return, you can't do trap neuter remove, or you can't remove the cats. And other things that excite me is when I see in the Wall Street Journal, or I see in Zillow or something like that, there's a house for sale, and the house comes with a group of cats in the back, and you have to sign on and be supportive of those cats in the backyard in order to buy the house. I mean, how cool is that? How cool is that you can now sell your house with your community cats? I think, thinking outside of the box, bringing cats up to a level of care that we're not going to move them just because we happen to have to move doesn't mean they have to move, and it can go with their, with the new owners. It is the trap neuter return is a best practice in all communities for reducing cat overpopulation. The largest amount of suffering in our communities for outdoor cats are for the kittens, right? So the younger the cats, the harder it is for them to be outdoors. So that's why we trap kittens and we bring them in and we socialize them and we put them up for adoption. That's why we do that. That's why when we get a cat that's about a year old or older, or in a safe environment, we're going to trap them, we're going to neuter them, we're going to ear tip them, we're going to vaccinate them, and we're going to return them back as long as they're in a safe space. If it's a stray cat, we're going to put a paper collar on that stray cat, and we're going to ensure that nobody owns that cat. And if you're interested in the link for the paper collar template that we have, it's super simple. put a paper collar on that cat for 2 weeks. If you can touch the cat, I understand not all cats are touchable, but if you can touch that cat, get a paper collar on that cat for a couple of weeks, you'll find out whether or not that cat is owned by someone else or not. So, these are things that we can do as part of our See It, Solve It in our communities, is really bring out the normalization of TNR. Use your volunteers to get on those chat groups and really just advocate strongly for TNR. Share educational resources. Everybody is passionate about cats. It's not just us that wants to know about the drop trap. It's the whole community needs to know what a drop trap is and how it works. And so these are simple things that we can do, but I know, a lot of us don't do it, but let's bring TNR, trap, neuter, return, into our normal day-to-day conversation when we're talking about outdoor cats. And I think that's really a great way to go. Certainly different countries have different situations with regards to trap, neuter, return. Where I am in Switzerland part of the year, they actually have a significant lower amount of what you would say are unowned community cats, but they have a very high tradition and culture of having indoor-outdoor cats. So most of the cats you're going to meet out there do have a designated owner and a caretaker. And so that's kind of interesting and unique to see what other countries are doing. And I love learning about what other countries are doing. Next slide. So I'm going to actually ask a quick question here to put in the questions box. How many of you say yes or no? How many of you are familiar with the community cat pyramid? Yes, I'm seeing yes, couple no's. All right, okay, great. So I'm so thrilled so many of you are familiar with the community cat pyramid. I really truly believe this is a great way of trying to share with others sort of a methodology of how to reduce cat overpopulation in your communities. And so, it's modeled after the food pyramid. I always am fighting with my diets and stuff like that. So I have to say, I see a lot of different food pyramids out there. And so I figured, well, if I'm going to look at a food pyramid, I might as well create a cat pyramid that's more entertaining. So just to try and explain sort of the general idea, which is, so many people use the line, we cannot adopt our way out of our cat overpopulation situation. And I will agree with that statement 100%. I'm not saying we should not do adoptions. I'm not saying we shouldn't do rescue. I'm not saying we shouldn't do sanctuary relocation. There's a place and a time for everything. Depending on what is going on in your community and the environment that you are operating in, you need to be able to look at this pyramid and evaluate. The best way, though, to move the needle with regards to the number of cats coming into your facility, if you are geographically focused, is assisting the owned cat population with spay neuter. That will reduce your kitten intakes by an incredible amount of numbers. And then more of your kittens that you'll be assisting will be feral kittens that are outside. You can be more aggressive and you'll have more resources to be able to help those kittens. Those are the most at-risk kittens. 75% of kittens don't make it through the first year. So, and I know that there are many organizations in Massachusetts that end up dealing more with the feral kittens than with owned kittens because more people have their cats spayed, and so there's fewer owned kittens. And so if you do want to really change the intakes for owned cats as well as for your kittens, making sure that base number, these are numbers, so this pyramid reflects the number of cats assisted during the course of a year. That base number should be like 1,000, and then you have trap, neuter, return, or return to field, and maybe that's more like 400, right? And this, you have to use some of your tribal knowledge to determine what would be good goals in your community. Then you've got rescue and adoption, so maybe that's 200, and maybe sanctuary and relocation is like 20 or 30. So there is a ratio, a community-based ratio and scale that works to make an impact with regards to the number of cats in your community. So there's a lot of back of the napkin type calculations that goes on here. And so I'm going to walk you through a little bit of the cat math on this, but that's sort of the methodology. Next slide. All right, so just this is like a little side note commercial here, talking about wildlife and trap, neuter, return, because I know that sometimes does come up. There are going to be protected areas where you will have to be more aggressive with regards to pulling cats out of a community. ever, I would not do a trap, neuter, remove situation in an environment where there are residences, because you're going to just repopulate the area. So the best thing that you can do is what I would call trap, neuter, return M, TNRM, and I would really promote that as a managed service to ensure that all cats are going to be spayed or neutered, and you will work with the community to ensure that everybody understands why there's a more aggressive initiative to ensure that the cats in the community are spayed or neutered. And so I'm happy to go on with cats and wildlife. I can talk about this for a long period of time, but if there are folks that are faced with this conflict, feel free to reach out to me and I'm happy to answer any questions. But the reality is they want to reduce cat overpopulation too, or they want to reduce the outdoor cat population. And there's a multi-pronged sort of solutional package that can be presented to them, with the understanding that if you're dealing with a situation where folks don't have access to affordable care for their cats, then they will see cats outside. And there's education that comes into play with encouraging cats to stay indoors. But the simplest answer is I don't want to live with an unneutered male cat, and I certainly don't want to live with a female cat who's in heat. And so that's one of the biggest reasons why those cats end up outside. Next slide. So this is another just initiative with regards to keeping cats indoors. And so I just recommend that you want to just, check it out. They do a catio tour and all that kind of stuff. And I might want to slip back to the community cat pyramid slide, Kristen, if I don't have the how to build it. Or do you want to go onto the website? Can you slip onto the website, to the community cat pyramid page? So this is our website, folks, if you haven't seen it. Thank you, Kristen.
Sorry, I just pressed the wrong button.
No, that's fine.
There we go.
Okay, and then down that resources page, just there's also the paper collar template is right down there on that. So if you scroll up, so this is how that pyramid builds, right? And so you've got that base level. So most of us, I'm going to ask another question here of the group. How many of you started out, go rescue, sanctuary, or rescue and adoption, sanctuary, TNR, and own spay neuter? Tell me which of these you started out doing first. TNR, rescue, adoption, TNR, TNR. Okay. So I want to find out what's your base of education? TNR. So we've got about 50% between TNR and rescue. There we go. Right. And great. Is this cat owned population? Okay, great. Super. Yeah. So there is a lot of rescue in here. And then with rescue, then there is the necessity for trap, neuter, return, because there is a discovery there that you can't adopt your way out of it. And there are situations where trap, neuter, return certainly works. And what happens to the cats, is the adult cats age out. Have any of you, another question for the group, have any of you had a colony of cats age out? No. Has there been how have you gotten your new cats in to your colony? It's currently happening. And aging out, I bet you, so it is happening in some areas and it's not, oh yes, a few areas here. Yep. Okay, so then, right. So the thing with that was the reason why our colonies aged out is we used to have a lot of cats dumped down on the Newburyport waterfront. And then what we did was we opened up our adoption component. So having an adoption component where we were service area based. And so we said we would take in any cats in need in our service area towns, regardless of who you are or whatever. So we actually opened up that door. So what used to get maybe dumped at a feeding station was now probably left in a carrier at our back door or on our deck or something like that, or else they were contacted us and we got them right in. So we tried to open up conversations rather than just having people forced to make really rough decisions. And unfortunately, I think that's happening right now, is that a lot of people are having to give up their pets because of housing issues. And I'm hearing about a lot of cats coming into apartment complexes, like at dumpster areas. And I think people are making some really tough choices with regards to their pets. And also, yeah. And so we have other challenges here because Our resources are limited, our rescue resources are limited, our TNR resources are limited, and our spay neuter resources are limited. And so we have to work on building this pyramid because the pyramid numbers change all the time. I mean, I had a conversation with somebody recently who said, you know, how can I do trap, neuter, return when I don't have access to any spay neuter appointments? And I mean, I have to throw my hands up. I mean, if anyone has the answer to that question, that would be like the $1 million question, honestly, is that you've just got to create some new solutions around that, which means working with private practices. In the 90s, I worked with 14 different private practice veterinarians before we had our Catmobile. So there really is important needs for us to create our own spay neuter capacity, because I don't think we can depend on others to do that for us at this point in time. So I'm going to do a little bit of if back of the napkin calculation. Kristen, if you can go back actually to the holistic picture, or the holistic picture of the pyramid. Oh, just on this too. So there's another video here which is an older presentation I did on it. We also have this information in Spanish on the community cat pyramid that you can download, and there's a flyer also that you can put your logo on. So just make sure we'll point that out on the website that folks can use this. I've had a lot of foundations like this graphic. So if there's a foundation, a community cat foundation in your, or just a foundation that's interested in helping with animal welfare, I think that, not to toot my own horn, but this might be very helpful in getting you some funding if you include this in your grant funding request. I've had several people who do distribute funds, and they've got this up on their walls, trying to think about this as how best use of their funds to be able to be impactful in the communities. All right, and then I'm going to do a little bit of cat math, and then I'm going to dive into some questions for folks here. So when I go into a community with regards to doing the cat math, is so it's sort of like a community needs assessment. You'll sort of figure this out. So community needs assessment will take the population of the community that you serve, and I usually start out with anywhere between 15 and 20% of the population of that community that you serve. Now, if you want to do an analysis on a statewide level or even a county-wide level, I would actually focus on like the 3 to 5 lowest income zip codes in that area. So you Google lowest zip codes in so-and-so county, or lowest zip codes in Dallas, Texas, or something like that. And you pull that up, and then you look at the 5 lowest zip codes and build from there. There may already be spay neuter initiatives in those communities, and then you can move on. But if you're looking at look at a strategy that's most impactful, that's where I would start first and build from there. And like I said, if we're talking California, you're going to want to break it up into small pieces. If we're talking Rhode Island, you're going to do the whole state. And you're going to need a certain component of owned spay neuter. So using Massachusetts as an example, we still have a significant need for affordable spay neuter for owned cats. Trap, neuter, return need, yes, less in some parts of the state. Other parts have had a bit of a flare up, and so they've had to pick up the amount of spay neuter that they've done. I think we might have Springfield out in the audience here today, and they can chime in if I'm wrong, but I feel like their trap, neuter, return program has picked up a notch, and they have a great TNR program that they started. But it's collaborating to get all this information together and understand where you're at. So if you are just an individual organization focused on several colonies, it's really great to try and collaborate and put a picture together to see what's going on across your area, to know that you're being impactful. It's frustrating if you feel like you haven't been able to make an impact. I was horrified when I went, one of my see it, solve it situations was, a dumpster behind a bar in Seabrook, New Hampshire, which had like 30 to 35 kittens in the dumpster with lots of broken glass and one eye glued shut for each kitten. So each kitten had to have one eye removed, and like 60 adults off in the woods over by an apartment complex. And, we trapped the kittens, and we got all the adults trapped and spayed and neutered after long hours. And I say that, it sounds so easy. It's not easy. It was a lot of hard work on the part of the volunteers that were doing the trapping, but they got those cats all spayed and neutered and supported with a feeding station. And 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 that colony is no longer, and we also did it at the dog track, which was right down the street too, which was another source of cats. And so it's, you have to be really focused to be able to be successful. So that's why we want to encourage the normalization of TNR too, which is we want everybody to be doing this. If everybody did trap, neuter, return, if everybody knew how to do it, had the resources to do it, we had the spay neuter for it, as well as having access to owned cat spay neuter, the world would be a very different place. And there's a variety of different initiatives that you can, support with on that. Another one is called feline-focused by 5. So encouraging veterinarians to spay and neuter at 5 months to miss that oops litter. And so that's certainly another initiative too. And so anyway, all right. And then I see a quick question here from Bridget on zip codes being irregular in census tracts. Yeah, I mean, honestly, what I'd say, just what you pick, just use it for consistency's sake. Whatever statistics you're pulling up, a lot of statistics, economic information is broken down by zip code. So just do some Googling, searching, and use what works for you. I think that is what's most important. Use whatever is most comfortable in your region. I know Tennessee is also different. They've got counties that are different and that kind of thing. So, all right. And then I am going to quickly I'm going to turn my camera on for questions. And we're going to see how long my microphone lasts. I think I've got enough little bandwidth here. Kristen, if you see anything in the chat that I am missing, just give a shout out. Catstats.org, and what is my opinion of catstats.org? So catstats.org, I think it's been around for quite a while. It is good for organizations. It's not good for, I'm going to cough, so I apologize. Hold on just a second. So it is not good for like individual cat tracking. So like if you're trying to track your own cat information, it's probably not worthwhile, but for an organization, I think it has quite a bit of value in tracking and understanding and that kind of thing. Brian Cordes is going to be presenting this weekend, and Neighborhood Cats is the facilitator, the owner of CatStats. And so I'd be happy to hold that question too and make sure I ask him when he is here this weekend. Okay. Oh, what is the 50 to 20% thing? Yeah. Okay. So cat math. So let me do my cat math. We'll do what I did for Lowell. Okay, so Lowell was a population of about 125,000 people. So here we go. Gonna get my calculator out here. 125,000 people. So I was sitting in a meeting in Lowell, and a lady who feeds the cats all around Lowell, all over the place. I said, how many, sitting around the table, like, how many cats do you think we have in Lowell? And she goes, 1 million. There's 1 million cats in Lowell that we need to help. And I was like, okay. And this shelter had been run by an organization, by a couple of gentlemen who, unfortunately, they were old school. They euthanized the cats and the dogs at the end of the week so they wouldn't have to come in and take care of the animals. So in 2007, they had changed their staff. They had much more progressive oriented staff that wanted to make a difference, but they were overwhelmed with cats and kittens. And while I'm talking, Kristen, I don't know if you can pull up in the blog for United Spay Alliance, but there's a nice little graph there that people might want to look at if you want to do a little search on that. So anyway, so what I did for my back of the napkin for Lowell before coming in 2008 is try to figure out what sort of spay neuter capacity does the community need. This is for everybody. This is for people who can pay $400 a cat versus people who have to pay $25. This is what we need to get into the community for spay neuter resources. And so I took like 125,000, and then in Massachusetts, because there is a lot of progressively oriented minded, I did it by 0.15. Let me see here, 125,000 times 0.15. Okay, so that gets you to about 18,750. So that's like, you need for surgeries for the whole community, you need 18,000, almost 19,000 surgeries a year to be able to support the needs of that community for cats. This is free roaming cats, and this is owned cats, and this is like your purebred wonderful cat or whatever. This number is the starting point. Then we go into the tribal knowledge, which is talking to every group that is involved in that community. So how much spay neuter do you offer? How much the private practices offer? Trying to capture like, where are we at on that number? And then what I did, we ended up only doing probably about only like 1,200 surgeries a year. So you're going, oh my gosh, 18,000 surgeries? This is crazy. And we started off with doing like 1,200. So back in 2009, you'll see this chart here for the Lowell Humane cat intake here. And you look at this chart, you see the owned cats in 2009, 500. When I first went into Lowell in like 2008, their conference room was stacked up to the ceiling with cages, like 3 and 4 cages all around the room. They had a cat room, they had another room. It was all up to the ceiling with cages. And they had kittens, cats. It was crazy. And then, so the Catmobile went in. We started doing every Monday, we were doing spays and neuters. We were doing the shelter spays and neuters. We were doing own spays and neuters. We were doing TNR. And then they actually, Lowell, in 2021 or so, they've actually opened up their own clinic now. So they've taken on a lot of that responsibility. With that being said, actually their clinic is for their shelter cats primarily, as well as for trap, neuter, return, and to serve other rescues. So their focus isn't on the owned because the Catmobile still kind of covers that area. But you see the line of the owned cats went down, and in the past, we really didn't know how to get the number of owned cats reduced in a shelter environment. But you can see here, obviously the kitten drop was like significant on the owned cat side. And then the stray cats came down, and so did the stray kittens. They went from having like so many kittens they didn't know what to do with to like a kitten. What's a kitten? We don't see them anymore. And so it was really dramatic. The first 5 years, it was a huge change. The kittens, especially that first 5 years, it was just very dramatic. So we start with the back of the napkin, and then we go and we work with tribal knowledge. So there was another organization called Kitty Angels that was there doing a lot of or a lot of rescue work and TNR work and that kind of thing. So we started out based on what we could do for our own capacity to see what kind of an impact it would make. And even doing a small number, 1,200, it was like 1,200, 15, 1,400, somewhere in that ballpark, we made a significant impact with that. We had a pilot group called Lowell TNR, which was a pilot project that then they became their own nonprofit. And now then they rolled into Lowell Humane, because then the volume of TNR calls are so low that now Lowell Humane can handle that load. And so there's sort of been a 10-year, 14-year evolution sort of here, where there was like a nonprofit, but just for like a slice of time, where they were really focused on that area, doing all the colonies, getting everybody done intensely. And then the local humane organization has enough capacity to take on that program to be able to hold it in that maintenance mode. And the math is kind of hard. It's very tribal knowledge-y, but I do usually start out with this benchmark and then try and either build up or down from there, because there have been other parts of the country where those numbers have actually worked out on the higher side.
Stacy, can you talk a little bit more about, as I was looking at the zip codes, people keep asking what you do once you get the zip codes. How do you choose the zip codes you choose? Like, what are your criteria for choosing, where needs these services and where it doesn't?
Right. So so in the case of Newburyport, since we're anchored in Newburyport, I mean, that was our anchor and we focused there. We chose our zip codes just as the surrounding towns around us. So that was like our target area, because that was our mission, was based on serving the Merrimack River Valley area, or Essex County, the county there. And so, but when you're looking at a county, you're going to choose the communities that have you can either do social vulnerability index, or you can do, the easiest is just to say the zip codes that have the lowest median income. So median, not mean, but median income. I would take those communities first and do a vetting on those communities and then build from there. So if I did the top 10 lowest median income communities, like in Massachusetts, we would have Brockton on that list, which has had a lot of focused efforts. Lawrence has had a lot of efforts. Lowell, I'm not sure it's in the top 10, but it's certainly in the top 20. Fitchburg's in the top 20. And Springfield is there, but it's got like a mothership of a spay neuter clinic there. So So anyway, but yeah, and if people want to do cat math with me, I'm happy to have a call with them and work that out.
Stacy is a lot of fun to talk to. If you get the chance to do it, you should. So I do see something else in here that's also kind of important for all of this work is fundraising. So how did you fundraise for these programs?
Right. So this Lowell project was funded by PetSmart Charities back before some of their protocols changed. So this was through Brian Cordes and PetSmart Charities. The Fitchburg one was funded through a community foundation grant. A lot of community foundations are now interested in funding animal welfare, but they don't know who to give money to in a way that's impactful. And so the community foundation, it's called like Northwest Fitchburg Community Foundation, has been a significant donor. There are other organizations. What happened when some of the larger organizations, Petco Foundation and PetSmart Charities, as well as some others, have chosen to do like bigger chunks of donations rather than smaller donations, we've turned to local community foundations, so to replace the funding that we lost in Massachusetts. So there is Grant Gopher is a very affordable search tool for funding. And then there's also grantsforanimals.org. Stephanie Mathers, she's got a great website with great resources. And then we have access to Instrumental, which we can filter out and do searches for you to try and find resources, because there's a huge amount of opportunities out there that you wouldn't think that they would be interested in funding animal welfare because it's like Bank of America trustee something or other, but they really could be your best donors. So they're almost like individuals. I mean, and of course there's donor advised funds and all that kind of stuff too. So I try and think of like finding the leadership donors that understand the strategic work and go from there. But if people have specific questions, I love prospecting for money. So.
Which is amazing because most of us hate it. The other question they had that was kind of part of that was that the donors, their regular donors, don't want to pay for spay and neuter. And we do have a fantastic presentation coming up a little later in this conference from the folks who do Scooter the neutered cat. And I think you're going to be fascinated by that. But do you have any suggestions for how one talks to a donor about spay neuter? Like, how do you convey how it's important in terms of that normalization, like if they're not even familiar with it, or it's not saving cute little kittens.
Yeah.
Do you have any thoughts on that? Like, what do you say?
Well, so a couple of things. One, I would obviously listen to their concerns and see, why are you not considering, doing a donation to, I mean, unrestricted or general ops funding is great because then you can decide where it goes, right? So general ops is always the best way to go on funding. But if you're trying to approach somebody specifically for spay neuter, then trying to understand, what their concern is. I mean, we all say, oh, everybody just wants to, give to the fluffy kitten or whatever. Well, I mean, maybe that's just because that's the only thing we show, right? That's the only thing we put out there. We don't test it. I mean, have you done like A and B testing? And then listen to them. The other thing is, I mean, you can certainly do this is annual report time, right? In your annual report, you can say it costs us $450 a cat to get the cat spayed or neutered, get it vet care, take care of the overhead to get it adopted out, to prevent a cat coming into the shelter and going through all of that hardship and whatever. The spay neuter is $125, and you've saved, if you want to use those terms, you've saved a life with $125 versus that 450. You could save 3 lives, right? I think it might come down to just thinking about your messaging, because a lot of organizations get really excited if your cost per cat goes down in your programs too. So if you did a Sunday spay neuter clinic, a Sunday MASH style spay neuter clinic, your cost for your supplies is going to be like $40, and maybe you have a little bit of staff overhead, but you do the volunteers, maybe throw another 20 on top, so that's $60 a cat. That's a pretty good deal for spay neuter for those cats. And they don't have to come in, they don't have to have volunteers coordinated to manage them and all that kind of stuff. It's a pretty efficient system for sure.
That's fantastic. I know one of the things that we used to do at Merrimack River Feline Rescue was we used to break down the costs for people. So we'd say like, this is how much a spay pack is. If you want to like up that, this is how much the whole surgery is going to cost. Like you could save a cat for this, or like people had like a tangible thing that they were
Yeah.
donating for, and
Yeah.
that really helped them understand like what they were getting for that donation,
Right.
which is interesting how people react to that.
Our Sandy Reese, I'll say, if you Google get fully funded, Sandy Reese, who's presented with us many times, she's got what's called the core number. And it's so, having a core number and going from there is really a great place to start for sure.
That's excellent advice. Let's see what else we have in here. We have, what's the first step to getting started running a TNR program? They work in a municipal shelter, but they'd like to start a program there. They don't currently have one. I think Cameron Grige's presentation is going to be a fantastic piece of information for you. But Stacy, do you have any in the see it? Once you've seen it, where's your first step in solving it? Like, who do you reach out to?
Yeah, for sure. So, I mean, if it's a municipal program, you want to just do a little bit of research and trying to understand what that exactly means. Is it a 501c3 program, or is it municipally funded? And do they have any restrictions or limitations with regards to having a trap, neuter, return program? If they've already accepted the concept and then they just want to see like a project proposal as to what it would look like, that's really great. We're actually going to have Stella from Pasco Animal Services going to be on for Q&A too, and they're municipally oriented, and so I can certainly ask her for her input on having a TNR program there. I also know that the animal control officers in Springfield at TJ O'Connor assist with trap, neuter, return also, and I think there's a representative out there in the cyber world from there. So, highly recommend just getting some background information from some other municipal programs that have done really well. Again, I would say try to be very focused at what you're willing, what can you offer and what can't you offer. So there's clear communication with the community, because if you're just doing a one person thing, then they're going to expect you to go out there and trap 2,000 kittens. And, how are you going to work? What are the expectations? Are you going to allow the community members to borrow traps and then have them bring the cats into the clinic to get done? Or are you going to have to do all the work? So just a lot of clarity about who's doing what, and that would be great.
Awesome. Let's see. There's a whole bunch of questions from Florida here, and what I would suggest for you guys is to hop on over to the Community Cats Facebook page for the conference group, and I will put that link in the chat as soon as we are done here, so you guys can connect, because a lot of this is about connecting with other organizations. One is Northern Florida, one is Southern Florida, but you guys probably could help each other quite a bit. Is there a resource for doing MASH style spay neuter clinics? And I know we have a presentation coming up on that, but Stacy, do you have any suggestions for where people could find that information to review later?
Yeah, that's great. Actually, we're working on that at the United Spay Alliance. We're calling it delivery systems. So some
Awesome.
of that information is already up there. I'm trying to think the MASH style clinics. Actually, if you go to Amy Ferguson's group in Seattle, spacing on the group's name, Spay Neuter Group, I will get that name, but they do consulting, spay neuter consulting, if you want to set up programs and stuff. And actually all the documents are on the website.
Fantastic.
Yeah, we interviewed Amy Ferguson, sorry guys, in Washington. I will get that in the chat over lunchtime. I'll get that information in the chat over lunchtime. But she has all the documents on, like, if you want to set up this kind of clinic versus this kind of clinic and that kind of thing. There was somebody else who was talking about mobile clinics. There's a program called Fido Fixers that loans out mobile spay neuter clinics for $1 a month for rent. And so if you do happen to have a veterinarian or do some recruiting for a veterinarian, you can get access to a mobile clinic. That's not a big obstacle.
Wow, that's incredible.
Yeah, $1
and
Catmobile a month, I'd go for that one. Yeah.
I know, right? I'm just thinking, like, I could just drive the Catmobile around. That'd be perfect. You have to staff it, though, I imagine. Veterinary shortage is something worth mentioning. I know we're experiencing it. What have you seen done by organizations to get veterinarians to participate in spay neuter programs?
So yeah, the veterinary shortage is real for sure. There's lots of challenges out there. I think that we have to think of ourselves in about 50% of the clinics that were operating, spay neuter clinics that were operating before COVID have gone out of business. So we're having a shift. And what we're trying to do sorry, I have to switch my plug over. I'm going to go off 2 secs here.
Okay. You guys are asking all kinds of fantastic questions.
Yeah. So anyway, there's a veterinary shortage task force at the United Spay Alliance, and they're working on a lot of these different topics. We need to ensure that when we hire veterinarians, we're going to retain them. We're not going to burn them out, and we really need to make things attractive. There has been a turning point, I'd say, in the last 8 to 10 months or so, where there's more action and more interest in working in the high quality, high volume spay neuter space, or I would say also more the purpose driven space. A lot of people went over to corporate and now they're thinking about coming back. So there have been some openings, but there's 10 new veterinary schools on the docket to open up in like the next 3 to 5 years. So that will help hopefully too, but that's down the road. That's a long-term thing.
Gotcha. A bunch of people want you to say the mobile spay neuter clinic rental place again.
FidoFixers.org.
All right, everybody write that down. FidoFixers.org.
Instrumental it's Instrumental TL. It is a grant prospecting software along with a grant tracking. So you can track your grants, you can, follow things along there and that kind of thing. It is expensive. It is pricey. I will tell you that. So if you want to get a demo and try it out, you can always just reach out to me. Grant Gopher's like $9 a month. And that one pings me with like different suggested grants based on the filters I put in. And so that's a lot cheaper.
That's $9 is doable, I feel like.
Yep.
So with the veterinary shortage, somebody's asking about if there's short courses for people who just want to spay, neuter, and vaccinate. I don't think that exists right now, but could you talk a little bit about what they're doing?
A speed sprayer?
For veterinarians.
Yep.
They exist, right? But can regular people do that?
Oh, okay. No, well, veterinarians have to perform spay neuter surgeries. If you have a veterinarian that wants to learn how to do them more quickly, there's the 6-Minute Spay, which is a website which has training modules that are virtual. So there's training there. The United Spay Alliance is trying to do wet labs in every state. We've done a couple in Maine. We're doing them in a variety of different states around. And then there's also Frankie's Friends in Western Pennsylvania. This is free, no charge. They do a high quality, high volume spay neuter training. It's frankiesfriends.org. And Dr. Becky Moreau runs those sessions. I saw a video of her doing a neuter and a spay. The neuter was in 30 seconds. The spay was in 3 minutes. And
wow.
So if we can just get these best practices up and running, everybody can save so much time, which means they can just do so many more cats, right?
Absolutely. So for veterinarians, you could offer to your veterinarians, like there are these courses, you guys can learn to do it pretty quickly. And then in terms of like people who are not veterinarians, do they have options for how they can be most supportive of the veterinary community?
Become a technician.
Yes, absolutely. Vet techs are
in
so
areas,
unsung.
More of a shortage of technicians than there is of veterinarians.
Oh, wow.
So it's harder to find technicians in many ways. Yeah.
So we are at 12:30.
Yeah.
I believe that is your time.
Yep.
So thank you so much for lending us your knowledge. I know you've been in this for a very long time, so great that you're able to share all this info with everybody. And I'm sorry about the date mistake in the beginning.
No problem. I was like looking, I was like, oh, did I go back in time? No worries. All right, everybody. Yes, we'll be back on in half an hour, 30 minutes.